All right, let's just jump right in. I want you to imagine a medical procedure that is so incredibly complex, so audacious that it replaces not just one, but two of your body's most vital organs at the same time. We're talking about the heart and the lungs, the very engine and the oxygen supply for your entire body swapped out in a single marathon surgery. This, right here, is the story of the heart-lung transplant.
So you gotta ask, why would anyone ever need an operation this drastic? Well, it all starts when a catastrophic failure in one organ cascades over to the next, creating this downward spiral that can't be fixed by just replacing one of them.
I mean, that's a terrifying question, isn't it? For a small group of patients, this isn't some hypothetical. It's a life-ending reality where these two systems, which are so deeply connected, get locked in this destructive dance. The failure of one basically guarantees the destruction of the other.
And this double organ failure, this terrible spiral, it actually has a name. The most common reason for it is a condition called Eisenmenger syndrome. And for these patients, this is the diagnosis that puts them on the path to this ultimate second chance.
So, how does this even happen? Well, it usually starts with a heart defect, something you're born with. This flaw forces blood into the lungs at dangerously high pressures. Think about it like this. Imagine a garden hose turned up to full blast, just constantly hammering a bed of delicate flowers. Over time, that relentless pressure just destroys the fragile blood vessels in the lungs. And once the lungs fail, the strain on the heart becomes too much, and it starts to fail too. At that point, both organs are, sadly, beyond saving. The problem was crystal clear, but the solution? Well, that was anything but. For decades, the very idea of replacing both the heart and the lungs was pretty much pure science fiction. So how on earth did we get from impossible to a reality? Well, the journey was long, and it was filled with setbacks. You had early experiments way back at the turn of the 20th century that proved, hey, this is possible, at least in a lab. But then, the first attempts on actual human patients in 1968, they were tragic failures. Patients survived for just hours, maybe days. It took another 13 years of relentless research before the breakthrough finally came. And that moment, it arrived on March 9th, 1981. This wasn't some abstract discovery in a lab. It was a real-world achievement by a dedicated team at Stanford University. Doctors Bruce Reitz, Norman Shumway, and John Walwork took all the hard lessons learned from decades of failure and turned them into the very first long-term success, giving a patient a whole new lease on life.
Okay, so the procedure is now a reality, but who are the patients that actually qualify for this incredible operation? Well, the reasons have kind of shifted over the years, but a few key conditions really stand out.
And when we break down the why, a really clear picture emerges. Pulmonary hypertension, that's the severe high blood pressure in the lungs we were talking about, it is the overwhelming driver here. I mean, whether it's caused by a heart defect like an Eisenmenger's or it just starts in the lungs themselves, it accounts for more than 2/3 of all cases. It's the big one. But check this out, this trend for cystic fibrosis. Back in the 90s, it was a much more common reason for needing a heart-lung transplant. But as treatments for CF have gotten so much better, fewer and fewer patients get to the point where they need both organs replaced. Many can now get by with just a double lung transplant. It's a perfect example of how progress in one area of medicine completely changes the landscape in another. Pretty cool, right? So, we have the patient, we have the donor organs, and now comes the moment of truth, the surgery itself. It's really an act of incredible coordination, skill, and just pure endurance. I mean, surgeons themselves call it one of the most demanding operations in their entire field. The anatomy is just so complex, the dissection has to be meticulous, and the stakes, well, they literally could not be any higher. Let's break down this marathon surgery. So first, the patient is put on a heart-lung bypass machine. This thing keeps them alive while their chest is, for all intents and purposes, empty. Then comes the point of no return. The surgeon takes out the patient's diseased heart and lungs. After that, the new donor block, the heart and lungs together, is lowered into place. And finally, the painstaking reconnection begins, sewing the windpipe, the aorta, and the major veins back together, literally bringing these new organs to life. But surviving the surgery, that's really just the first big hurdle. The journey for a heart-lung transplant recipient is a lifelong commitment, and it's filled with both incredible promise and constant challenges. So what does survival actually look like? Let's start with the big picture number. The overall median survival for all patients is 4.5 years.
Now, that means half of patients live longer than that and half live for a shorter time. But that number, it really doesn't tell the whole story. Because look what happens if a patient can successfully get through that critical first year. The median survival more than doubles. It jumps all the way to over 11 years. So getting through that first year, with all its high risks of infection and acute rejection, it is absolutely paramount to long-term success.
And that first year, and really every year after, is dominated by this one major dilemma. Patients have to take these powerful drugs to suppress their immune system. The whole goal is to stop their own body from attacking the new organs. But in doing that, they're lowering their defenses, making themselves highly vulnerable to all sorts of potentially deadly infections. It's this constant, delicate, lifelong balancing act.
So let's say a patient successfully navigates this balance for years. What becomes the biggest obstacle to living a long, healthy life? Well, the greatest threat turns out to be this slow, sneaky process that targets the new lungs. It's called chronic rejection, or to get more specific, obliterative bronchiolitis. Even with all those powerful drugs, the body's immune system can still mount this kind of low-grade, long-term attack. And over years, this causes scarring in the tiniest little airways of the lungs, gradually and, unfortunately, irreversibly closing them off. And we're not talking about some rare complication here. About a third of all patients will be diagnosed with this form of chronic rejection within just 5 years of their transplant. It is the single biggest hurdle to long-term survival, and it's the main reason that these incredible second chances eventually come to an end. So let's quickly recap the key takeaways here. This is the ultimate last resort when both the heart and lungs fail together. It was made possible by that historic surgical breakthrough back in 1981. We've learned that survival is really a tale of two numbers, and getting through that first year is absolutely critical. And finally, life after the transplant is a constant tightrope walk between rejection and infection, with chronic rejection of the lungs being the biggest challenge of all. Which leaves us with one final fascinating question. At the end of the day, the two biggest challenges have always been the scarcity of donor organs and the body's eventual rejection of them. So as we look to the future, you have to wonder, could the next great leap forward come not from better surgery or new drugs, but from a completely different source for the organs themselves? The answer to that, well, that could change everything.